Hello, everybody. My name is Frank Jordan Roberts Jr. I go by my nickname Jody. I appreciate you all taking time to show up today. You're important stakeholders in our battle against COVID, and I'm looking forward to our conversation that we're going to have regarding COVID vaccines and whether it's making a difference in the communities in Maine or not. But before we delve into that information, it's an important topic. I want to talk a little bit about mental health for all of us. It's been a crazy couple of years. Things looked like they were getting better, but unfortunately, as you all have seen in the media, due to some variants in the viruses out there, things are changing a bit from a public perspective. And I know there's a lot of people that have been suffering from a mental health perspective. So I've got a little image that I scanned in that used to hang in an office where I worked. And it's a simple concept. It just deals with, are you happy? So being that we've been dealing with a bit of informatics and stuff in public health lately, I thought I would share this with you all because it's something that's meant a lot to me through the years, and I think it makes a lot of sense. So again, the question is, are you happy? You got two choices, either yes or no. So for those of us that are happy, you follow the flow chart, just keep doing whatever you're doing. However, if you're one of those people that might be struggling a little bit with your mental health and the answer might be no, then you ask yourself, do you want to be happy? And if the answer is yes, then change something. This seems like an overly simplified topic, but it's something that really I hold dear to my heart. It's something when I have conversations with people, when I see people struggling, I really just try to identify, what the situation is. I do believe that happiness is a state of mind, and I think it's important for all of us being public health professionals that we do acknowledge the fact that many people out there are struggling. So certainly it seems fair if I'm going to have a conversation about vaccinations and public health, that the first thing we hone in on is trying to make sure people are happy and people are healthy. Because without happiness, what good is our health at the end of the day? So we've had a problem with the pandemic. As you all are aware, we've got COVID-19. It has impacted Maine in a variety of ways. It has sickened a lot of people. It has killed a lot of people. And now, fortunately, we have vaccines available. For a long time, people were wondering when they would ever come out, if they ever came out, if they worked. And one of the big debates out there today is, do these vaccines make a difference? Do they work? Why is it important that I get vaccinated? Well, the reality is all of this is very complicated. We all fit into this complicated puzzle in a variety of ways. But I think it's one of those topics that is best that we just talk about openly. So I'm going to present you with a little slide which basically shows the stakeholders, from my perspective at least, in looking at vaccines in the state of Maine, and also from a national perspective. I presently work for a vaccine manufacturer. We deal with influenza vaccines as well as adult travel vaccines and pediatric vaccines, and we do have some COVID vaccines in the works. So when we talk about stakeholders, what do we really mean by that? Well, stakeholders are people that kind of have skin in the game. So truthfully, I think every human being is a stakeholder in one way, shape, or form when it comes to dealing with COVID and dealing with the pandemic, because it impacts all of us in different ways, shapes, and forms. So in this diagram, I basically tried to sum up different groups or boxes, and they may or may not relate to some of you all. I know in polling the audience when we started here, we've got a variety of people, being people that work for the insurance payers. We've got people from the hospital system, some of our legislators. We've got a variety of people in the audience here today. But I just want to talk about how things differ between groups, but I want to hone in on the fact that even though this slide appears to be a little bit busy, and I'll move it around a little bit so that you can see all of the different stakeholders, the reality is no one is really free from risk or benefit or harm in looking at how we're all intertwined in our communities. So obviously, when the pandemic came along, the legislatures, they worked to release money so that they could get those to manufacturers and supply chains to try to get everything ramped up to try to produce vaccines, because they knew that would be one of the best ways to try to get things under control. They also had to work with insurance companies and payers and stuff, and the CDC and the government to come up with vaccines, make them affordable, and make them efficacious. So they're all intertwined. As you can see, there's multiple areas coming from all of these stakeholders as you go through there. Now, then they have to be able to distribute these out there. So you've got supply chain people that are out there. Now, no one is free from risk with all of this. While everyone is working, trying to get vaccines out there before they were available, people are at risk. There are many people that got sick. Legislatures got sick. People died. You had manufacturers, people at those companies. Our company shut down. Everyone's been working from home for a long time. You've got insurance companies. They're evaluating risk-benefit, trying to decide what they're willing to pay for, looking at how expensive it is when people end up in the hospital from COVID infections. Hospital systems that up here in Maine, we had a lot of them that were, at risk of going under because they were having to defer lots of elective surgeries and things that they would normally bill for in order to have hospital beds available for people that were sick with COVID or needed to be put on a ventilator. So everyone had a role to play in the pandemic, and then the vaccine came out. So the vaccine came out, and that's why I've got in the center here of this diagram your consumer, your vaccine recipient. That's everyone. That's whether it's legislators, people that work for the supply chain, the manufacturers, the hospital systems, the school systems, media, business owners, you name it. But then you've also got an important group out there as well, the people that have chosen not to get vaccinated. And those are the people that are really coming into the spotlight right now, and hopefully people that we will be able to reach out to and impact, because data is showing that these are the people right now that COVID is really impacting. Fortunately, since the vaccine came out, most of the older sick individuals and people at risk went out and got vaccinated. And so far, the data shows that these vaccines do work very well. But these non-vaccine recipients, these people that still, for whatever reason, have chosen not to get vaccinated, right now tend to be the people at highest risk. So what I did is I put together basically an infographic to try to share with you all the information that I pulled from some reports that came from the CDC, both locally and nationally. And all the references for my graphs and my data will be at the bottom of the infographic. Just basically speaking to COVID-19 and showing what a difference time and the vaccines can make in a population. So the reality is, the data in Maine shows that vaccines do make a difference between people who catch COVID-19, people who get hospitalized, and those people that die. So I'm reaching out and hoping to encourage everyone, if you haven't been vaccinated or you know anyone that has not, please encourage them to do so. It's the best thing we all can do from a public health perspective. So back when COVID first started in Maine, I was fortunate. We lived in a rural area, and there really weren't a lot of cases up here initially throughout the year, but that started to change towards the end of last year. As you can see in this graph, our total cases kind of crawled along. I was fortunate. People did social distancing, business, shut down. Everyone sacrificed the way we were advised to do. But then towards the holiday season, we started to see things creep up as far as the cases. They were growing exponentially. This unfortunately translated into increased hospitalizations and deaths, as you can see from the graphs from these data sets. It's pretty scary because at this point, we didn't have vaccines, didn't know when they were coming. But fortunately, vaccines first started being made available and administered in the state of Maine in late December. So when you look at these graphs about how things ramped up, now you see where we started to vaccinate here in January. And this graph shows the percentage of people out there that started getting vaccinated. This data runs through June. So now we're up over 50%. And you could see the dramatic difference it made within not only the total cases of COVID, but in those hospitalizations and, more importantly, the risk of death. So clearly vaccines made a difference, but also the fact that unfortunately you had a lot of people in the population that were catching COVID infections. They were gaining natural immunity, having been impacted by the virus directly. So a combination of vaccine availability and people unfortunately getting naturally, catching COVID, that's what really made a difference in slowing down the spread of COVID. Now, this seemed to be a good picture, but as you know right now, things are changing a bit with some of the variants out there. But presently, according to national media, 99.5% of known cases are with the unvaccinated individuals. And unvaccinated people account for 97% of hospitalizations. So I can't stress that enough for people out there. There's ample vaccines available. I really don't know, unless someone has an underlying, medical rationale why they cannot get a vaccine, why anyone would look at numbers and statistics and data like this and still decide they don't want to get a vaccine. It doesn't make any sense to me. So I encourage you to reach out to everyone and try to share data with them, find out what their concerns are, but please encourage them to get vaccinated. I view vaccines very much so like I view insurance or seatbelts or airbags. Just because you have insurance doesn't mean you're not going to get in an accident. Just because you wear your seatbelt or have an airbag, one, doesn't mean you won't get in an accident. It also doesn't mean you might not get injured by that seatbelt or the airbag. And it also doesn't mean that you're guaranteed 100% that you're going to survive that accident. However, having insurance and or a seatbelt and or an airbag and or a vaccine, although they do not offer you 100% protection for anything, the majority of data out there shows, although nothing is risk-free, that all of these protective measures make a difference in preserving quality of life, reducing injury, and ultimately reducing death. So it's one of those arguments I have a hard time of people saying, I just don't want to try that vaccine. I don't trust it because the data says otherwise. The data shows not only that getting vaccinated can protect you from the disease, but it also shows that if you do catch the disease, your chances of becoming really sick or getting hospitalized or dying are much, much less if you have gotten that vaccine on board. So there's presently 3 vaccines in the United States that are available. You have Johnson & Johnson, you have Moderna, and you have Pfizer. So I would encourage you, if you have not gotten any of these vaccines, or if you have questions, please talk to your medical provider or pharmacist or any of the people that work in any healthcare setting in public health. We all want to do what we can to protect our community and to help save lives. If you do have underlying comorbidities, you are at much higher risk of complications for a variety of things, but certainly more so from COVID. So please get vaccinated today, protect yourself and your family. Getting vaccinated can reduce your risk of infection by up to 91%. So please get vaccinated today. If anyone has any questions, feel free to reach out to me. I'll be sending an email out to all participants and also including a copy of the slide deck. I appreciate you all showing up today, listening to the information I've shared today. Hopefully my presentation has convinced you that vaccines do matter and that we need to do everything we can to try to increase vaccination rates for all the people in our community to try to protect the most vulnerable. Thank you very much.